Hi guys, you're welcome to another edition of my program called Health Talk with Queen Nikki. Okay, so what's going to be our topic today is just general health. General health. I've done several videos about hypertension, diabetes, stress reducer, and a lot. But it's becoming more alarming how people are slumping and dying right now. I've had for the past few weeks where people are just taking shower and they slump and pass on. It's becoming things that we need to really take care of our health. There are so many people going out there on the street where they have underlying high blood pressure that they are not even aware of. Mostly people in African country. See, let me tell you, I've made mention of it in all my health video that we have what we call chronic illness. Chronic illness, these are the sickness that you can deal with. You've had it. There's nothing you can do about it. The only thing you can do is just to prevent it so it doesn't further damage your system. But what are the things that you can do to avoid it before you don't even have that disease process? Now, let's say, for example, I'm just using this for example now. If you know you don't have high blood pressure, but you have stressful lifestyle, the only thing you can do is to reduce stress, exercise, eat right. See, let me tell you, most of the things we put in our mouth, these are the things that we tell our patient as a nurse. Most of the things we put in our mouth is what is affecting our system. Once you're able to eradicate 80% of what we put in our mouth, like control it, eat healthy, eating healthy lifestyle, eat a lot of fruit, vegetable, protein, less carbohydrates, simple sugar. Avoid anything that will destroy your system like alcohol consumption, smoking, unhealthy lifestyle. Once you can do that, that's the 80%. You see the other 20% is exercise. Be active. Once you do that, trust me, you'll be fine. But let's say you already have hypertension or diabetes. There are so many things you can still do while you're still taking care of yourself. Let's say you are taking medication. There's still something. You still have to modify your diet, live healthy lifestyle. You still have to exercise. You still have to do stress reduction. See, with hypertension and also diabetes, you still have to do what we call stress reduction. That's why I emphasize it in multiple of my videos, that do whatever makes you happy. I'll give it as example. I love music. I love to watch TV sometimes, not all the time, sometimes, and then read a lot. So what I do is, music is my number one. I love music. So I play music because each time I listen to music, I sleep off. I sleep peacefully. I forget whatever stressful event that I'm going through. Let's say like work event. As a nurse, we do get stressed out. Look for what makes you happy. Some people, when they watch funny video, it makes them laugh and they forget about their issue. Now, this is stuff that can help you to manage that disease process at that point. But we still have to look for the short-term and the long-term treatment. When last did you go for your doctor's checkup? Do they have to remind you before you go there? How often do you do your blood pressure? How often do you do your blood sugar check? How often do you just go to your doctor and say, you know what, I'm okay, I'm feeling fine. Your primary care doctor, mostly, even in African country. How often do you go there and just say, I just want you guys to check me out, make sure I am okay? But even if you don't go to your doctors, what are the things that you can do at home? This is relaxation. Yoga exercises there. You can walk around your compound. Watch what you eat. There are some processed food out there that is dangerous, that have high sodium. Reduce it. Or, better still, don't do it. Don't even drink it. Drink a lot of water. How often do you drink water? How often do you use the bathroom? This is another thing. How often? Are you drinking the recommended water that you need to drink per day? Are we taking fruit? There are some people that don't like fruit, like they eat it. Like me, if I eat too much fruit, I get tired of it. So what I do is I blend it to make it like smoothies. And if I cannot make it a smoothie, there are some organic smoothies that I can buy. And do you know, if you eat fruit, you get glow skin. If you drink a lot of water, your skin glow. You get hydrated. You have that energy to walk. These are the things that we need to put at the back of our mind. People are slumming and dying. Take care of yourself. Stress management. I have video on my Health Talk Queen platform on TikTok, YouTube, Instagram that you can watch that can help you to manage stress. See, there are some situations you can't control in life, but you can manage it effectively. Don't overlook warning sign. When you see warning sign of, let's say, chest pain is very, very serious. When either it's mild chest pain, hard chest pain, severe chest pain, any chest pain, if you go to the ER, they take you as priority, because it might be warning sign of heart attack or any underlying issue that your healthcare provider wants to dig into. If you have headache that is not resolving, even if you take headache medication, it's still there, please seek help immediately. As a female, are we taking our multivitamin the way we should? Because we do our monthly period, are we taking multivitamin? When last do we visit our, doctor for our general well-being? Very important. So exercise, eat right, stress reduction, and enjoy life. Enjoy life. And remember, if you're praying and said, okay, I'm praying, and you don't do the necessary thing, like as in science, which is going to your doctor, you're playing with your life. You're playing. And I've seen some people send me messages and say, hey, I can drink, there's the minimum, they said red wine is good for the heart. Yes. But let me tell you, as I'm not saying people should not drink red wine. Don't quote me, you understand. But there are some certain age you will be, I think 40 above, that you need to take things easy. You need to take things easy, and then your health, take it at number one priority. Consumption, alcohol, smoking, be careful out there. Because even in the liver, it said they are liable to die young. Cardiac arrest is real. Heart attack is real. Diabetes is real. Hypertension is real. Take care of yourself. Eat healthy. Drink water, hydrate yourself, reduce stress, be happy. And that's the only way you can do to manage yourself. Life is too short. Life is too short. People are dying. And I pray that God Almighty will give us this wisdom to be able to take care of ourselves. And while you do this, please remember, if your children too, they need to, whatever adults go through, children to go through it. Make sure you're keeping their doctor's appointment, also their mental health. Now, very important, as you're doing your own mental health, make sure you check on your children too. They might be going through some things in school that you want to investigate, and also their environment. Make sure it's healthy. They get their immunization, everything that they need to do to grow, to become the leaders of tomorrow. I hope as we are doing this healthy tip thing, we are going to be going advanced and then take care of ourselves. Thank you. And don't forget to subscribe to my YouTube channel, Health Talk Queen 1, Instagram, and my TikTok, Health Talk Queen. Till I see you guys in my next video, remain blessed and ciao, ciao.